If someone has arthritis, how would you treat it?
Yeah, I mean, the first question you have to have for the patient is, do you want to save the joint or eventually do you want to replace it? Because if you have arthritis, it's progressive in nature and never gets better on its own, it only gets worse. And that's because of the mechanism of action. If you have arthritis, basically what's happened is either due to overuse trauma or post surgery, your body has released these proteases or little proteins in the joint to clean up damage. But as we get older, we'll say past 30 to 35 years of age, your joints become avascular and these proteins become trapped in the joint. So think of them as termites in there, and they start to eat away at the joint, and that's the cause of arthritis. And if you don't get rid of the termites, eventually the joint's going to be gone. Now, unfortunately, traditional medicine, the way they treat this is a lot of people would do over the counter like NSAIDs.
Mhm.
Now, that's like a very common, but the problem with NSAIDs is it does nothing to get rid of the proteases. And they work on this pathway called the COX2 pathway, which actually inhibits cartilage growth. So if you have termites in there eating away at your cartilage and you're slowing down cartilage growth, what do you think the NSAIDs are going to do long term? Actually speed the process up.
Mhm.
Another typical medical treatment would be like a corticosteroid or steroid injection. But once again, although it's a very potent anti inflammatory, they also speed up cartilage degradation. That's why you're only allowed to get 2 shots per joint per year because every shot can cause up to 7% bone and mineral loss.
Mm.
So if you get 2 cortisone shots a year, that's 14% loss on top of the termites eating it. So if you're going that route, you're just saying, I want to replace the joint, which is a choice. But obviously, an artificial joint's never going to be good as what God gave you if you can save your own joint. So a more logical approach for the patient that wants to save the joint, and if they haven't gone too far, is to basically do a structured program. And step one is you got to get rid of the termites. And the only way to do that is to use A2M, which is alpha 2 macroglobulin. And basically, that's a product that a physician can make from your own blood. Um, A2M is actually a circulating protein in your bloodstream. It's the largest protein in your venous system, but it's so large it can't get into your joints. What a physician can do is they can take your blood and filter it down and capture that specific protein, that alpha 2 macroglobulin protein, and then use a needle and put it into the joint. And when you put it into the joint, it breaks down the proteases in the joint. It's like bug spray, it gets rid of them.
Mhm.
So you get rid of the cause of the arthritis. And then usually what I would do in between time, because there's two parts to this, because we're going to do something to help the tissue grow back on the backside, but you have to wait 6 weeks. So you got to prepare the joint for 6 weeks. So you're going to put the A2M in there with some scaffolding, and it's going to sit there for the next 6 weeks and just get rid of all the proteases in the joint, prepare the joint, and get it ready for the next step. I would also, in the meantime, use BPC 157 combined with NAD and GHKCU. These are all peptides that promote angiogenesis or circulation. They modulate the cytokines, which help get rid of pain. GHKCU is also very good for cartilage growth. So that combination via iontophoresis, you wear that patch 12 hours a day on the joint you're treating. So you're bathing that joint with everything it needs to get rid of the inflammatory cytokines, to increase circulation there, and help grow back cartilage. So making it very anabolic. And then after 6 weeks, I would either do a double spin PRP, not single spin, double spin PRP, or potentially like a Wharton's jelly allograft or exosomes. Like they all kind of work the same way. That's really the provider's preference. But what that does is you picture this, it's kind of like the garden analogy. So you had termites in your garden eating your tomatoes or flowers. I don't, termites probably don't eat flowers,
No,
but
probably not.
we'll say beetles
They eat the
eating your
trees.
flowers.
Mhm.
So step one is you kill the beetles. Step two is then you basically the BPC patches with NAD and GHKCU is kind of prepare the soil, like kind of till it up a little bit. And then step three is now we're going to put fertilizer in there so they grow back. So that's how that three-pronged approach, the A2M first, BPC, NAD, GHKCU to get the soil more ready. And then let's add the fertilizer so things grow back, whether it's Wharton's jelly extract, exosomes, or double spin PRP to help things grow back quicker. That's a true way to fix a joint long term. And people ask, well, how long does that last? What should last as long as you last? Because if you're growing back tissue and you got rid of the cause of the arthritis, you're not going to have to go have any more treatments in the future.